the Pepper Valley's show and tell. And we have a special guest today from Oakland, California, Dr. Mark Sharpiro, who's going to talk a little bit about his chiropractic practice and how he helps and benefits people in your community, yes, in Northern California, and helping them stay more active, yes?
Yes.
Okay, so Dr. Sharpiro, how long have you been doing chiropractic?
I've been a chiropractor for 20 years.
Okay, and where are you located at?
I'm located in Oakland, near Summit Hospital.
Okay, and you have a practice there?
I'm part of a group practice. It's called East Bay Pain Care. We have chiropractors, acupuncturists, massage therapists, yoga instructors, and women's health.
Okay, so do you have a story, a special story about somebody that you've helped in the time that you've been doing chiropractic for the past 20 years?
Yes, there are a couple stories that come to mind.
Uh-huh.
I have one patient that I saw about 15 years ago. He was a professional photographer.
Uh-huh.
And for some reason, he began developing numbness, tingling, and weakness in his hand.
Uh-huh. So what did that look like?
He had a MRI and some nerve conduction tests. He saw a neurologist who told him he was having progressive nerve degeneration.
Sure.
And he was going to develop what's called a claw hand.
So he wouldn't be able to take pictures anymore?
No, he wouldn't be able to take
Okay,
pictures anymore.
uh-huh.
And when I examined him, I noticed he had some misaligned vertebrae in his lower neck and upper back, which is where the nerves go from the neck to the arm and hand.
Uh-huh.
And he did have some weakness in his hand, but his hand was still pretty much functioning. He hadn't reached the full claw hand stage at that point.
Uh-huh.
So I gave him a series of adjustments, about 10 over the course of maybe 3 or 4 weeks.
That's perfect.
And he recovered completely and went about his normal activities.
And would you say about 10 adjustments is what you do on average, or does it just vary for each person?
It varies. I would say, though, that most conditions respond to 2 to 10 treatments. There are a couple exceptions. One is people who've been in bad accidents, like an automobile accident. It takes a long time for the muscles and ligaments to heal, just like, you know, a baseball player can be out for the season.
Sure.
Someone can be out for the season with a bad injury.
Sure.
And another thing is a really bad herniated disc can take a very long time to heal.
And when I met you a little while ago, we were talking a little bit about your practice. You had told me about a story where somebody was completely recovered. What was that story?
Actually, I was telling you about a woman who
Yes.
played field hockey in college,
Uh-huh.
and she sustained a series of concussions that were pretty serious.
Sure.
And she had problems with her memory, concentration, and mood. And she recovered, but as a result, after recovering, she had daily neck pain and also daily severe headaches. And the headaches were aggravated by normal activities of daily life, like even cycling or exercising or working out. And the neurologists who treated her were very helpful, but all they could offer her for her headaches was medications such as Imitrex.
Oh, yeah.
And that actually caused rebound headaches, which made it worse.
Mm-hmm.
So
that sort of put a Band-Aid over the situation. It didn't fix the situation.
no, it didn't fix it, and she was, as I said, you actually, if you start taking those medications a lot, the rebound headaches become worse than the actual problem.
Sure, sure. And you were able to completely recover her.
Well, I was able to help her quite a bit.
Sure.
She had misalignments on both sides of her neck, and when you pressed in those misaligned areas, she'd have the symptoms of her headache.
Sure.
So that's how I knew it was a chiropractic problem, and chiropractic could help her. She's had about 20 treatments. She's also had some massage and some other types of therapies. She says she's 75% better, and she can exercise, she can work out, she can do all of her normal activities, and she's continuing to improve, and I expect her to improve further, which is, given the severity of her injuries, that's a fantastic result.
And that's a huge contribution. I mean, you're helping people to be active and get back out and what they love to do. Yes?
Yes, absolutely.
So you had mentioned a couple times about adjustments. What exactly is an adjustment? If somebody were to come to you and ask you, what's an adjustment, what would you say? How would you explain that?
I would explain that an adjustment is a safe, controlled force applied to the spine or the joints in the arms and legs that restore normal movement and normal position to joints that are out of alignment. And the force can either be very gentle or very more forceful, depending on the age, health, and the type of problem that the patient has. Traditionally, adjustments have been done by hand. but recently a lot of technology has been developed that allow for adjustments to be done by instruments, which is much gentler, that there's no turning or twisting or popping as well.
And you brought an instrument with us today
Yes,
to show us.
I did bring
And
an
we
instrument.
have a wonderful, wonderful, wonderful prop, gentleman, Andrew Pape, that you can show your
Yes.
instrument. And if you want to come around this side
Okay.
and show him a little bit,
So
show us a little bit.
the instrument, the impulse works on the electricity, and I will just palpate the area of his neck where he has a problem, which I happen to know is right at the sort of the middle of the neck here. I just place the instrument here right on the misaligned vertebra, and I squeeze the trigger, and there's just a little tap. If I feel the vertebra is really stuck, I'll hold the trigger and can do multiple taps. Now, it might not seem like that was a lot. It's equal to the force that goes into the instrument adjustment, but the difference is, as I said, there's no turning or twisting, and it's entirely painless. This is 100 times faster than the human hand. So it's so quick that the patient barely feels it. It's much suitable for people who are seriously injured, for young children, and for older people. Then as people recover, when they have more movement, you can do the manual adjustments. The manual adjustments are more helpful because they restore full range of motion to the muscles and ligaments.
So Dr. Shapiro,
Yes, Christina?
why would somebody come to you as a chiropractor than somebody else? What's unique about you? What do you specialize in?
What's unique is I've been in practice for 20 years and I incorporate a large range of techniques. I use instrument adjusting, I do traditional hand adjusting, and I do a lot of rehabilitative exercise in conjunction with treatment. Anyone has had any sort of problem with their neck and their back, unless it's really, really minor, has some chronic underlying weakness with their muscles and ligaments. And they need very kind of exact scientific exercises to wake up those muscles. Otherwise, they're going to be prone to additional injuries. And it's rehabilitative exercise is different than working out in a gym. It's very controlled, specific movements, and I do that with all of my patients. So it's a complete program of care, adjustments, rehabilitative exercise. We have massage therapists on staff if they need massage. We have acupuncturists if they need acupuncture. If they need some supplements to help them heal, I also do provide those.
And how would somebody get a hold of you? Where are you located?
I'm located in Oakland, California, near downtown Oakland, across from Summit Hospital.
And your address?
It's the clinic I work in is called East Bay Pain Care. It's 3300 Webster Street, Suite 408, Oakland, California, 94609.
And then how would somebody call you?
They could call me at East Bay Pain Care at 510-444-2772.
Perfect. And did we ask, do you have a website or an email address that somebody can contact you with, or is there
Well,
another way?
eastbaypaincare.com is our website.
Okay, and you have a link on there.
Yeah, I have a link on that, but I actually use a different email address.
Okay. What is it?
It's Doc Mark Shap, that's DOCMARKSHAP @sbcglobal.net.
Perfect. You know what, Mark? It was wonderful to meet you. God bless you guys. And we'll be back in a moment with another doctor in the Oakland area, Dr.
Anthony.
Anthony Pape, and we'll talk a little bit.
Actually, that